Here, I will discuss the neck anatomy we need to know to perform a thyroid US. Neck ultrasonography should cover the area from the sublingual glands to the sternum and clavicle. It should include the center neck region, as well as both the left and right sides of the thyroid glands, including the posterolateral neck. Today, I will be covering the center region and related issues that a performing operator needs to be aware of. An US probe is about 5 cm in width, and this size can cover the sublingual glands on each side of the neck. However, this does not mean that the US examination can be done in one swoop. Clinically, it is difficult to do an US in one go from top to bottom. To sufficiently study the center portion of the neck, the performing operator should focus on the very middle portion and the outer sections of the neck separately. This means that a clinician will normally have to go over the neck structures 3 or 4 times from top to bottom. The sublingual glands are in the upmost section of the neck. However, the US probe has to be tilted and pushed upward before they can be seen on US. You can see the glands on the medial surface of the mandible on CT. On US, the sublingual glands on each side of the neck are echogenic. After the sublingual glands, we come down to see the hyoid bone. The space between the epiglottis and tongue base is the vallecula. It is full of air. But for clinicians unfamiliar with the vallecula, this air will be the cause of confusion when interpreting the US. This is echogenic hyoid bone. This is vallecula with air. Calcification and air can both look echogenic on US, but it is easy to tell them apart. Calcifications normally have a dark clean shadow. In comparison, air is normally seen with a dirty shadow of various echogenicities. We call this type of shadow ring-down artifact. In some patients, the air-filled vallecula will be prominent. On this ultrasound image, the air in the vallecula is apparent. We can confirm that this is the vallecula on CT and that it is perfectly normal. Thyroid cartilage is placed under the hyoid bone, and may present air density on the lateral side. Here, you can see definite dirty shadowing of the air. In this axial and coronal CT view, you can see normal pyriform sinus. Pyriform sinus is placed at similar level with thyroid cartilage, and we can frequently see similar images with air. This is an image of pyriform sinus air. This US image was taken with the probe first placed right above the thyroid cartilage and moved from top to bottom. You can see air with various dirty shadow, which is perfectly normal. Here are some short clips of the structures I have gone over. Sublingual gland. Tongue base. Hyoid bone, in order. You can see epiglottis and vallecular air. This is clip of another patient. You can also see echogenic bilateral sublingual gland. Tongue base. Vallecular air. Hyoid bone, in order. This is another patient case, which starts from hyoid bone. You can see prominent vallecular air and air shadow. You can also see air shadow near thyroid cartilage, which is pyriform sinus. This is clip of pyriform sinus, placed slightly under thyroid cartilage. You can see air shadow in pyriform sinus. If we continue down from the vallecula, we will see the thyroid cartilage and the cricoid cartilage. The thyroid cartilage is shaped like an upside-down V, while the cricoid cartilage looks like a horseshoe. Sometimes, patients are referred for an FNA because the inferior horn of the thyroid cartilage is mistaken for a thyroid mass. This is the upper part of the thyroid and the thyroid cartilage. Slightly under, you can see prominent inferior horn. By slowly rotating and tracing the thyroid cartilage using US probe, the inferior horn is easily differentiated from a mass. The cricoid cartilage is also sometimes mistaken for an thyroid mass. On the longitudinal plane, it might look like an abnormal mass with calcifications but is not seen on the transverse plane. Similar to the technique explained right before, if you can slowly rotate or trace the mass in question from the thyroid cartilage using US probe, you will be able to confirm that what seemed like a mass is just the normal cricoid cartilage. This is an image of the normal thyroid gland. To perform in US, we need to be aware of the normal typical structures that are adjacent to it. Behind the thyroid gland is the esophagus, which presents in several layers on US. In some images, air is clearly shown, just like this clip. For those who wish to study air and its appearance on US, the esophagus is a good structure to start those studies. This patient had a very small esophageal diverticulum. Let me play you a clip of the US. On the outer thyroid gland, behind the common carotid artery, you may see the middle cervical ganglion. This is another structure that can be prominent in certain patients. If the thyroid gland has already been dissected, this structure is sometimes mistaken for recurrence. So how do we know it is not something to be concerned about? It is close to the inferior thyroid artery. If you trace it, you can see that it branches off, indicating that it is a normal structure. Again, we have had patients referred for further examination due to this finding. When performing an FNA on the right thyroid nodule, needle can nip the middle cervical ganglion and cause Horner syndrome. Therefore, extra caution must be taken. In some cases, patients will be referred due to surrounding muscles on US images. This patient was referred to differentiate a mass other than the parathyroid gland that was behind the thyroid gland. The structure is the longus colli muscle, which can be shown very differently according to probe angle. Now let's move on to lower thyroid part. This patient was referred to our hospital due to suspicions of recurrence on US after removing the thyroid for cancer. An oval echogenic area is observed on the transverse and longitudinal images. This US image is of a normal parathyroid gland taken at our hospital. Let's take a look at this clip of normal parathyroid gland. On this transverse section, we see the lower section of the thyroid. And if we go further down, we can see the normal echogenic parathyroid gland. This is also seen on the longitudinal section as well. By paying attention to the surrounding structures, you should be able to find the normal parathyroid gland in most patients. This patient was referred for an FNA due to an extrathyroidal mass close to the sternum. The structure is normal fibroadipose tissue. We can see a great amount of fat on CT. Fibroadipose tissue is commonly seen at the lower portion of the thyroid glands, but in this case was significantly prominent on the left side of the neck. Thank you.